Hi, my name is Kelly McGinnis and I'm a registered nurse. There are lots of problems in the workplace for sociological and cultural diversity. Understanding these issues and how to work with people from different backgrounds is important. No matter where you live, there will be time when you must deal with discrimination, stereotyping, sexism, or ageism. While there is a cultural factor to each of these aspects, the primary belief remains pretty constant around the world that these aspects could be of some concern depending on what country. Nurses bring their own personal ethnic background, as well as the cultural and learned views and understanding into the workplace. As a result, it is important for the nurse to recognize that a patient nurse encounter will involve the interactions of three things: the culture of the nurse, the culture of the patient, and the culture of the location. There are many local and global issues that pertain to problems in diversity. Diversity means differences and comes in various forms. It might be sociology of diversity, biological diversity, cultural identity, diversity through socioeconomic status, or others. Understanding cultural diversity is very important at all levels of the nursing practice. Judging another's culture solely by the values and standards of one's own culture to the nursing practice are unproductive and wrong when providing health and nursing needs of culturally diverse groups of patients. It is a good idea to learn about different cultures and their beliefs on healthcare, whether nurses are working in a clinical setting, education, research, or administration. Social practices have shaped issues of diversity in modern culture. Through education, schools are teaching courses on diversity and cultural issues. For instance, the United States citizens usually schedule appointments to see a doctor, while Latin Americans just walk into practices and wait to see the doctor. Nurses and medical care workers should get information by reading materials that offer many opportunities to achieve a wide range of understanding in the diverse world. There are many diverse religious beliefs that have changed how people are medically treated in the United States. For example, pain management is another medical practice that varies among cultures. In some places, having the ability to withstand significant pain is considered an admirable trait, and the use of pain medications such as anesthetics and painkillers is discouraged. Nurses must also accept and learn about the diversity in interpersonal relationships. Whether the patient is heterosexual, homosexual, or transsexual, all should be treated fairly. Today, society has been more accepting of diversity. There are many policies and laws that protect people's rights and consequences for prejudice of different cultures, ethnicities, genders, or religions. Furthermore, diversity is one of the most important issues in nursing. The United States has become more diverse in its beliefs, values, and life experiences. There are cultural factors that influence social changes, such as values and attitudes. There are historic people such as Buddha, Jesus Christ, and Gandhi who have changed the subject of religion. Others, like Napoleon, Hitler, and Karl Marx, have caused major changes in politics. Notable writers, scientists, and philosophers have made contributions to social change. Ideologies like liberty, equality, and socialism brings about significant changes in the world's social and economic order. Understanding these issues of diversity and how nurses work with people from different backgrounds is important. No matter what job you have, all people must deal with discrimination, stereotyping, sexism, or ageism. Nurses bring their own personal background into the workplace, along with their cultural views and understandings. As a result, it is important for the nurse to recognize that a nurse-patient encounter will involve the interaction of three things: the culture of the nurse, the culture of the patient, and the culture of the location. It is important to overcome these issues of diversity. There are many benefits with a diverse workforce that help with better nursing performances, that lead to happy patients, that then leads to increased hospital profits. but some serious challenges are communicating with many different languages and understanding the different cultural medical beliefs. Understanding cultural diversity is very important at all levels of the nursing practice. Judging another culture solely by the values and standards of one's own culture to the nursing practice are unproductive and wrong when providing health and nursing needs of culturally diverse groups of patients. It is a good idea to learn about different cultures and their beliefs on healthcare, whether nurses are working in a clinical setting, education, research, or administration. A good reference for learning more about specific health issues and beliefs of different groups is the book Culture and Nursing Care, a pocket guide. Discrimination in the medical field against any patient because of their color, race, ethnic, or religious beliefs or culture is wrong. Any unfair treatment of patients should not be tolerated and appropriate actions taken. Various studies imply that exposure to different cultures, beliefs, and languages allow nurses and the medical community to improve the caring and medical treatment of diverse patients. Diversity is a demographic fact that cannot be ignored and changes with population growth. Through continued education, nurses can keep up with any diverse cultural issues that can affect patients. The healthcare field should always be aware of different ways of treatment for the ever-growing diverse population. Also, having a diverse nursing population can also help provide better healthcare for the ever-changing diverse society. Nursing's leaders recognize a strong connection between a culturally diverse nursing workforce and the ability to provide quality, culturally competent care. Patients with diverse backgrounds sometimes have to deal differently with medical issues because of their beliefs, languages, or cultural diversity. Understanding beliefs or other languages can give better understanding of the patient's issues. Lack of cultural diversity can lead to discrimination or bias in the workplace and can affect patients, employees, and the entire healthcare organization from getting and giving the best care. It is essential to know that the overall performance of how the patient is treated and cared for will measure and determine if the patient's healthcare system is successful or needs further training with understanding and social diversity. It is important to figure out how a nurse can deliver patient-centered care when the patient's health beliefs, practices, and values are in conflict with medical and nursing guidelines. Cultural competence is an expansion of patient-centered care and a necessary set of skills for nurses to attain in order to render effective patient-centered care. As the population becomes more and more diverse, so must the healthcare system with their policies, procedures, nurses, doctors, and others. Today, the nursing workforce does not adequately reflect the diversity in the population, including gender. There are 4 things that help improve cultural diversity in the nursing workplace. Make recommendations, develop a strategy, implement the plan, and then enjoy the successful benefits. Since many people's different ethnic backgrounds have increased, healthcare providers and organizations have to look at recommendations to improve cultural diversity. Tackling cultural diversity goes beyond just knowing the values, beliefs, practices, and customs of African Americans, Asians, Hispanics or Latinos, Native Americans, Alaskan Natives, and Pacific Islanders, just to name a few. Other phases of diversity deal with religious affiliations, language, physical size, gender, sexual orientation, age, or disability, both physical and mental, political orientation, socioeconomic status, occupational status, and geographical location. Nurses and healthcare workers need to address these issues as well when dealing with their patients. Informal or formal strategies should be used to address issues of discrimination or racism in the workplace. All medical workers should become cultural aware by examining and exploring one's own cultural background. It is important to recognize one's biases, prejudices, and assumptions about individuals who are different. Identify any knowledge you may have regarding different cultures. Seeking and obtaining cultural knowledge about your patient's health related beliefs and values involves understanding their worldview. The patient's worldviews will explain how they interpret their illness and how it guides their thinking, doing, and being. Quality healthcare services may mean something different for each patient. In providing these culturally responsive services, their nurse may want to consider the following questions. In caring for this cultural group, have I asked myself the right question? You're looking at awareness, skill, knowledge, encounters, and desire. Another way to implement a plan to deal with diversity in the workplace is through a recruitment process. It is an effective approach of improving attitudes towards the patients and even other employees who are of different races and cultures that should include developing a strategy that promotes diversity. Today, the nursing workforce does not adequately reflect the diversity in the population, including gender. Training is another approach to deal with cultural diversity. Healthcare employers should provide employees with training that is necessary to learn about different diverse backgrounds and that unfair treatment can have consequences. Lastly, developing policies and procedures can give workers a place to reference the values and beliefs of many cultural diverse backgrounds and ways to proceed with care. It would focus awareness on how to develop a relationship that included mutual respect and appreciation of similarities as well as differences. There are a lot of benefits to make a plan to help nurses and other healthcare providers address cultural diversity in the workplace. Minorities are now 37% of the U.S. population and are projected to consist of 57% of the population by 2060. Experience and skills related to cultural diversity can help improve and expand the healthcare delivery systems. Other beliefs and cultures can give examples of different kinds of services, delivery systems, clarification of illnesses, and methods of treatment. Ethnic groups frequently use conventional and traditional healthcare sources, but there are some who do not. Their beliefs of illness and treatment methods must be addressed. Cultural diversity is one of the main concepts that nursing is centered and defined. Nurses need to know and recognize how a cultural group understands life processes, how cultural groups define health and illness, what cultural groups do to maintain wellness, what cultural groups believe to be the cause of illness, how healers cure and care for members of cultural groups, and how the cultural background of the nurse influences the way in which care is delivered. Diversity in the nursing workforce provides opportunities to deliver quality care which promotes patient satisfaction and emotional well-being. Thank you, and just as we started diversity with the song Imagine by John Legend, please enjoy this version by Pentatonics.